Welcome to Fun Health with your host, Dr. Tanya Gold, your happiness doctor. Dr. Gold is a medical doctor who specializes in natural medicine and has been in practice for over 23 years. She's also a registered yoga teacher, public speaker, and published author. Dr. Gold has transformed thousands of lives through her ability to make wellness fun using her behavioral associative conditioning method and new 20-second workouts. If it's fun, it'll get done. Dr. Gold believes you're not a diagnosis. Your health matters. Know you're not alone. Dr. Gold cares. Remember, you're a bright, shining light in this world. Keep shining.
Hey everybody, it's Dr. Gold, and we have a beautiful woman here who's going to be on our question panel, and I just want to say thank you for being here today. So today we are going to be talking about hormones, and I don't know if you've ever had this personally. I know it keeps going back, but are hormones making you crazy? We're going to dive into it. And we had a few questions about hormones, what the specific questions are. I'm sure I got this. Yeah, just what can I do if I have, how can I have fewer or mild or hot flashes, especially at night, especially if you wake up at least 3 times every night with the hot flashes, and this person has been drinking less caffeine, putting cold towels, lowering the temperature, which I'm sure her husband might be or family members might be a little cold. I know I've been known to do that before I got my hormones treated. And then using bamboo sheets, wearing breathable tank tops, and then should I be worried about osteoporosis as a thin 53-year-old woman? So those are wonderful questions. So we're just going to kind of dive into the basic first. So remember, we can use terminology too. Real women don't have hot flashes; they have power surges. But there still could be they can still be a pain in the butt. And feel free, if you have any questions, just ask. And if you're listening to this, of course, you can put comments in the chat, and I'll try to answer it as soon as I can. All right, so first disclaimer, this information does not constitute personal medical advice, so please always consult with your healthcare provider if you have personal questions, and you can always go from there. And then just an overview, we're going to be talking about the fundamentals of hormones. I'm going to give a case study, but I'll also answer the specific questions that was asked. We'll go over a little bit of the anatomy, hormone regulation, some key hormones, and the cascade. So this is Mary. She's 47 years old, tired, not sleeping well, forgetful, gaining weight. And she also told me she was suffering with hot flashes. Okay. So what's happening with her? Okay. So differential diagnosis, remember when you have hot flashes, it may be due to other things. So I usually ask the person, first question is always, have you had your hormones checked? Because if all the hormones are balancing out, they're normal, it might be other causes. So you don't want to miss anything that could be underlying. I actually had one patient, this is not to scare anybody, but it's just to pay attention. She was actually having hot flashes, but it was actually due to her heart. So thankfully, we checked her hormones, they were fine, but we said, let's just get, a full workup. And that's when we found it. Everything worked out fine for her, but it is good to make sure you're not missing anything else. So other things that can cause hot flashes, if the thyroid is off, especially hyperthyroidism, hypothyroidism can cause fatigue or tired, sweating sometimes as well. Adrenal fatigue. Sometimes other people have known it has different names like mitochondrial dysfunction, or just where your body is just exhausted. And that could be due to a lot of stress going on in your life. You have iron deficiency or some other vitamin deficiencies. So it is good. You can do a NutrEval or nutrient test. We can always talk about that later if you're interested. And then just checking about stress, because sometimes when stress is causing it, not just from the hormones, but other reasons, that could affect our ability to regulate our temperature at night. And then depression, anxiety, diabetes, you just want to make sure you're not missing anything, especially if you're just feeling down or fatigued also. So the definition of menopause is no periods for 1 year. So that's good to know that as well. Okay, so, and yeah, the average age is about 52. And this is a really common picture of I have the other part of that picture. I couldn't fit it on the slide, is the other family members like freezing cold. I know when I was going through the hot flashes, I was literally lowering the temperature so low. My husband was freezing and I was still warm. So yes, we can joke about it, but it is good to have a little sense of humor. It's making the lightening the situation so we can handle it, but it's not making light of the situation. It still can be pretty, uncomfortable, alarming. And I definitely feel for what you're going through, because I've gone personally, it's not fun at all. So especially like literally I'd be like so hot and just I was like, no, I'm not kidding. I slept in like a little like thin nightie, just take it off. It's crazy. I know. So typically, if you do want to know also if you are going through menopause, it's the definition is the absence of cycles or menses for 1 year, one continuous year. But you can also check your labs, because if you're seeing a trend in low estrogen levels or elevated FSH, which is the follicle stimulating hormone, it's what produces those follicles. If you see those levels going up, it means that we're heading towards the menopause most likely. So these can just be some indicators.
Okay.
And then the next one. Okay, we're not going to go into the singing uterus, but if you do want to see these videos,
And now, ladies, we take you inside your body for a special sex education message.
Hey girl, you thought you were done learning about your body after age 12? Well, your uterus and your ovaries disagree. Menopause is when your period has been over for 1 solid year, around age 50. But the process of menopause starts much earlier, I fear. Holy crap! You can start getting symptoms 6 to 10 years before, and that's called perimenopause. Perimenopause, perimenopause. Whoa! When it comes to fertility, things can get hairy. Not talking about your legs. We're not judging. 'Cause by age 30, you can lose up to 90% of your eggs. And then by age 40, only 3% remain. And that's called perimenopause. Not Peri Gilpin. She played Roz on Frasier. Take it, clitoris.
Now during perimenopause, the menopause symptoms begin. Headaches, insomnia, memory loss, and whiskers on your chin. Your libido is crashing, your waistline is growing, it's PMS squared. Plus there's something called vaginal atrophy, which means
Dryness, itching, pain during sex,
and burning urination.
You may be wondering how we got all this paper inside you. That's not important.
The thing to focus on is that your best years aren't behind you. Get baseline fertility tests around age 30. Make a menopause doc your best friend. Communicate with your partner. It'll all work out, 'cause in the end, you can't get pregnant, don't have a period, plus all the kids will be gone.
Till then, there's perimenopause.
Not Peri Gilpin.
Not Peri Gilpin.
I know it just goes into like, details of perimenopause and menopause, but a lot of it, we're going to just go into kind of specifics. So what are hormones? They're messengers in the body. They actually are secreted or released through the blood. They regulate our metabolism, regulate our sexual function, the way our bodies are using food, and reacting to emergencies, and also just the way we feel in our levels of, if we have anxiety or depression, it can regulate that as well, and metabolism and growth. Okay, so the key players, as you're probably familiar, the estrogen, progesterone, testosterone. DHEA is a precursor to testosterone, and cortisol is that fight or flight hormone typically released when we're under stress. But we do need cortisol for basic survival, which is important. We just want it regulated. And this is just the anatomy part of where these hormones are located, or the glands are located in the body. But where we're going to pay attention is the ovaries for the females. Thyroid is also really important because they do play a role with those ovaries. So if your metabolism's off, if you're having hyper or hypothyroidism, which could be detected, from symptoms as well, mainly from looking at your labs too. So it paints a whole picture to help us. Okay. And then those adrenal glands, as you can see, kind of in the mid back. Everyone usually thinks adrenals are really low, but they're kind of in the mid back. They usually sit over the kidneys area, and they, especially when we're going through menopause, they can also start producing the estrogen and progesterone when the ovaries start to kind of shrink as we go through menopause. So the adrenal glands can take over for production of the hormones. The problem is if you're under a lot of stress, then they don't have that capability as well.
Mm-hmm.
Yeah. Okay. So hormone regulation, these are just knowing from in the brain area, you can release some GnRH, which is the gonadotropin releasing hormone. They release something from the pituitary, which is another part of the brain, FSH and LH, which actually produces our hormones, the estrogen, progesterone, testosterone. Testosterones also produce adrenal glands as well as the ovaries produce that. And then you can see another area of the brain where it produces cortisol and DHEA. And that's part of these adrenal glands that we were saying that sit on top of the kidneys. And then I did have another YouTube video, but I can send you these if you want to see it.
Okay.
Okay, so this menstrual cycle, we're not going to go into lots of detail, but I just wanted you to see how, you know, the beginning of that part, if you look at the bottom.
Yeah.
So it's just when you're bleeding, basically, when the cycle starts. And then this is the lining of the uterus right at the bottom. So you can see it setting, it's going down, and then it starts building back up. That's why the estrogen levels, if you look at the second part where it says ovarian hormones, estrogen going up, it starts going down, but then the progesterone takes over. So estrogen helps build up the lining. The progesterone helps maintain that lining. And it's also involved, if you do get pregnant, to maintain pregnancy. So that's why it's really important to check your hormones, especially for people that are infertile, to see what their hormone levels are. But we've had a lot of folks help them. My sister was one of those people who her progesterone just tended to be low. And once we actually gave her progesterone, she was able to maintain her second pregnancy, which was nice. Yeah, especially if you're getting a miscarriage after miscarriages, be helpful. Yeah. Okay, so let's move on. And this is just repeating that, just another overview. As you can see, the testosterone comes up a little bit during the ovulation cycle.
Yeah,
but then it really levels off, especially in women. But men and women produce similar hormones, just in different amounts.
Right.
Yeah, so that's why if you are, because a lot of people say, Dr. Gold, if I weight train, am I going to look like a guy? We just don't have enough testosterone to get us so muscular. Okay, and this is like a dance break. If you're sitting, just stand up and stretch your body. It's really important to move. You don't want to sit all day, because our bodies can tighten up. And this also helps the release of hormones, because you feel better. So the feel-good hormones get. Okay, so estrogen, what does it do? So I mentioned earlier, it's a primary female hormone. It's also produced in males. And we know it's actually produced by the ovaries, adrenal glands. The big thing is it can convert testosterone, can convert to estrogen in the body fat. And this is really important in guys, because if you're not exercising, you're not moving, and you're gaining a lot of weight, especially in the abdominal area, the men's testosterone, so can women too, it can actually convert to estrogen. And having too much estrogen can make us moody or bloated or just not feeling good. We want everything in balance. So just and there's different types of estrogen. The one that's right below is estradiol. That's the primary estrogen during reproductive years. Estrone, I always think of the O in estrone as menopause. It's a primary estrogen when we are in menopause. And then estriol is pregnancy, the primary estrogen during pregnancy.
Okay.
So, and estriol tends to be the weakest estrogen. Not that it doesn't work, but if we're ever replenishing hormones, we usually give estriol. We may also give some estradiol.
Right.
All right. And then the function. So it really is really important for, breast development, secondary sex characteristics, genital growth. It builds up the lining, as I showed earlier. The big thing, especially as we're getting older, is bones. It actually builds bones. And that's why it's so important that we have enough estrogen, especially in menopause, when you might say, well, you just mentioned that estrogen goes down.
Right.
We need good estrogen. And I do help a lot of people supplement their hormone needs. So if their estrogen is lacking, we actually do give estrogen. And there's safe ways. I brought one. This is my actual prescription, but it's an estradiol patch. The reason this is important is some people will take estrogen orally. You do need to be cognizant of blood clots, especially with birth control pills that have high estrogen and other stuff in there, even progesterone. But so we're going to actually differentiate. I didn't discuss this yet, but I'll do it right now, is the difference between bioidentical, which just means exactly the same as our own body produces, bioidentical hormones versus synthetic hormones. If you're getting just traditional birth control, most of that is synthetic. However, they do have some bioidentical hormones that are prescriptions. So if you do get the estradiol, it can be bioidentical to our bodies. So can some of the progesterone, the capsules, they can be bioidentical to our bodies too. So I usually recommend that because why? The other ones sometimes are called Premarin, like that's a estrogen, and it comes from pregnant mare's urine. That's actually how they came up with the word Premarin.
Right.
Pregnant mare's urine. But a mare is a horse. I probably don't want a horse's urine. I'd like to have,
Right.
Yeah, so I'd like to have the hormone that's directly or exact to my own body. So that's what I usually recommend. And then the patches, you bypass the gut. So it's less likely. They haven't shown studies where the estradiol patch has caused any increased cause for getting a blood clot or anything like that. So because you're bypassing the gut, it's not going through the liver. So if you put a patch on, it's going directly into the bloodstream, and you can get your estrogen levels up without increasing your risk for a blood clot. So that's my kind of take on the patch. If you ever have a problem with it, you can always take it off. So I'm a big fan of the patches just because they're a lot easier, I find, for my people. And it's just twice a week. So just one patch twice a week. All right. So if you need it, of course. And then also estrogen in the right proportions, it helps with the collagen production, because we know that can sag, our skin can kind of, lose its texture and all that stuff because of lowered collagen as we age. But this actually, the estrogen thickens the skin. It actually raises good cholesterol and also helps with brain flow. So reducing your risk for Alzheimer's. And that's why, again, if you don't replenish the estrogen, if you need it, you actually, postmenopausal women with low estrogen are at the same risk for heart disease as men. And we know men are at higher risk when women are premenopausal compared to premenopausal women. So really important. We want to reduce our risk for heart disease. We want to reduce our risk for a fracture, dementia, because women are one of the highest risks for Alzheimer's too. So much better to, lower that risk with good blood flow. And again, it's not just estrogen, but, making sure we're hydrating and learning something new, all the good stuff, exercising, all that stuff that we need, good nutrients in our body. Estrogen also helps with serotonin. So it's, again, those feel good type neurotransmitters in our bodies, and also the good endorphins I was just mentioning. So good, important, feel better. And progesterone, again, produced by the ovaries, placenta, as I mentioned, it helps maintain pregnancy, and also the adrenal glands, but it helps you with the preparation for conception, helps with regular cycles. The big thing I find, it's very calming. I call it the relaxing hormone. It helps if you're under a lot of stress. It can also help with bloating so it kind of counters the estrogen effects. So if you have way too much estrogen, which we know it can get a lot of estrogen from hormones and meats or other places, if we're balancing with good amounts of progesterone, that can help. So you want good amount of estrogen to progesterone ratio. The cool thing with progesterone too, it helps with traumatic brain injuries. So as I said earlier, men and women produce it. We find in some men with traumatic brain injuries, their progesterone, even though they have smaller amounts, is way smaller. So if the ones that do recover faster from traumatic brain injuries, if they've incurred that, if they have progesterone in their system, or if you give them progesterone, sometimes that improves the TBIs, which is pretty cool, the traumatic brain injuries. Just on a side note. So it's neuroprotective, helps the brain. Testosterone, primary hormone, we need it for building muscles. It's produced by testes in males, and females by the ovaries, as I said. And it is produced during menopause, which is cool. The adrenal glands and ovaries can also produce some of it, but it does decline with age. That's why it's so important to have good muscle mass to keep our bones strong. Okay, and what it does for the men, the facial hair and body hair, you can get a lower voice and muscle mass, as I've said, and the muscle, the bone density as well. So it helps with maintaining libido. So if you're seeing people that their sex drive is lower, this is important, especially in men. We definitely want to make sure they have testosterone, but I do this for my females too, give them a certain amount. It's much lower doses compared to males. Okay, and DHEA, as I said, comes in pill form, but it's a precursor that our bodies naturally produce. That the DHEA is a precursor to testosterone and estrogen. So you need this as a key player to make those other hormones. And it can go down especially if we're not exercising or our adrenal glands are stressed. And it can also help with depression, obesity. So it's really good. Yeah, some of these can lower steroids or birth control pills. Some psychiatric disorders can lower the amounts of DHEA. The side effects, if you ever get too much, sometimes you can get oily skin, or if you're taking DHEA, some people say, well, if it's a little is good, maybe I'll take a lot. Then you can have, because it can convert to testosterone, you can have more hair growth in different places. And then for men, again, because it can convert, if you get too much testosterone, if they're overweight and it converts to estrogen, they can have some breast tenderness or some other symptoms like acne. It can also increase the prostate or breasts. I always say just be mindful of the amounts. Usually low doses with some breaks is a good idea. Okay, and it didn't show strong evidence slowing the aging process, although it has helped a lot of my patients with energy and building some muscle too. Okay, so cortisol, we know, is that stress hormone, the fight or flight. It maintains blood pressure and blood sugar. And it does help stimulate fat. So if people are trying to put on weight, but not the muscle, but fat, to make, yeah, I know most people are not trying to gain a lot of fat.
Yeah.
It also stimulates insulin release. That's hence the reason for the weight gain. Okay, so, and also we know if you have too little, obviously we need cortisol for survival to help with our blood pressure, blood sugar, but too much or too little sometimes can make us feel fatigued. Too much sometimes it can depress the immune system, impair wound healing, leading to ulcers, osteoporosis, again, because we're so stressed, our body's not absorbing nutrients as well. And it can lead to protein being broken down, so muscle wasting, which is not good, and then accumulation of more fat. They call it the Cushing's disease, where you can actually see it around the neck area or kind of chest, or they call it a hump on the back, which again, we try to stay away from that when possible. So getting too much, some people are taking cortisol, you have to pay attention to that, or taking too much steroids, you have to pay attention. Let's see, but in the right amounts, it can help with feeling better. I have something called cortisol manager, where if the person has too low cortisol, it bumps it up a little bit, or if it's too much, it helps regulate it. So you can start to feel more yourself. This is a cascade. We're not going to go into details, but the big picture is you need cholesterol above to make your hormones. Because a lot of times people are on cholesterol or statin medicines, and they're like, and if you need to be on it, of course, but my big thing with that is pay attention what your levels are. And if your hormones are dropping, or excuse me, your cholesterol dropping way too low, it can affect your production of other hormones. So these are the key players. Cholesterol, if you look down, it makes progesterone, and that gets converted to the DHEA, testosterone, and estrogen level. And it's just another depiction of that. And this, I know some of the hormones got a little blocked, but those are the estrogens, progesterone, again, coming from cholesterol. So we do need the good cholesterol, which we know you can get from eggs. Eggs, actually, the yellow part of the eggs have cholesterol, but typically it's saturated fats that raise our cholesterol, not cholesterol itself. And the yellow part of the eggs are really good for the eyes. So I would just say to source your eggs well. I go to the farm, but if you can get them pasture raised, it's so much better. And if you can get it organic, hormone-free, I understand cost, but doing your best for that. Okay, so we're going to answer your questions. I just wanted to have that as a background.
Okay.
Okay, so let me go back to your questions again. I'm just going to repeat them and answer. So what can I do to have fewer or milder hot flashes, especially at night? First, have you had your hormones checked?
No.
Okay, so that's one good start. And we gave you the list, but I can always text you that list. But I would check your hormones, especially also include vitamin D, which is a hormone as well as a vitamin, that can affect mood and your immune system. But I would check the estrogen levels, progesterone, testosterone, and there's a level called free and total. Some people ask, should I get it by blood or should I get it by saliva? If you have an opportunity to get it by saliva, it tends to be a little more sensitive, the test, and we can talk about costs in places, where it's covered depending on your insurance. Sometimes it either can be covered or you use a health savings account. Blood tests are typically covered, but sometimes the whole numbers are just a lot smaller. So it may not be sensitive. I just wanted to share. I'm going to get a sip of water. But when you check your hormone levels, then we'll actually know, and you can do something that usually is covered by insurance. It's called the cortisol saliva test. So it'll actually check what your cortisol levels are throughout the day. And remember, typically some people or doctors have ordered by blood, but if you're getting a blood test, that can already, think of how you feel when you're about to get a blood draw. Does that affect our emotions, right? So I know for me, I'm like, that already can inadvertently raise our cortisol levels, which we don't want. So instead, if you do it by saliva, it's a lot easier for you, but then we can get more accurate results too, because we're not. So that would be my recommendation in general for checking. That's what I typically do with my patients. But once we get a diagnosis, if we look at the actual labs and see what's going on, and we say, oh yeah, so say the labs do come back, you're not having cycles for a year, so by definition, you're in menopause, you are having low estrogen with high FSH, then, typically what I would say for hot flashes, estradiol bar none, the patches are by guidelines have shown to reduce hot flashes as long as there's no contraindications. And you might say, well, what are some of the contraindications? If you actually have breast cancer or active, risk factors for that, we would be cautious. There are some supplements like black cohosh or some other chaste berry or some other things we can do modifications like you're doing already that we can add to that if you're not able to tolerate the hormones. But for those that can, estrogen has done really well for my patients. And even my aunt asked, well, can I have some of the tempeh or soy, non-genetically modified soy? She's been fine with it. And my aunt had breast cancer twice, but it was the early stages. But I only say that because if you look at people in Japan or the Women's Health Initiative, which is from the 1990s, it was over 50,000 women they looked at. The women that had the highest risk for breast cancer actually had the lowest levels of estrogen. So if estrogen actually caused breast cancer, it shouldn't be those women, right? It shouldn't be women that are older. It should be pregnant women that get breast cancer the most. They actually get breast cancer the least. So I say that because it really does matter source. And we found the patches tend to be pretty safe. Again, I would never, this is not personal medical advice. I would say speak with your healthcare provider about these factors, and we can speak further on that, if you want to let me know. But caffeine is always a good idea to reduce caffeine and alcohol, because remember, alcohol can affect our deep sleep and can make us come awake, as also it can make us pee. So in the middle of the night, we can wake up a few times to go to the bathroom. But yeah, if it is indeed hot flashes and there's no risk factors for what I just mentioned above, I would consider the patches. And again, different doses. If you're sensitive, you can always start low, but if not, we start on a regular dose, and we can always go up as well, depending on what's happening. So just recheck. Let's see. And should I be worried about osteoporosis? I would also ask, have you had a bone density scan?
No.
Okay. So I would check, and it is early. You might say, well, my doctors pay for it. It's not usually that expensive. And the nice part is you can get a baseline for you. Because yes, there are guidelines, start at 65, but why wait until there's a problem? Now, if you are thin, I would, also mention, weight training, strength training, resistance training, and also good calcium sources, not from dairy. I know it's a misnomer. We all think, oh, I need to get milk. Well, some of my patients think I need to get dairy from milk, or calcium only comes from milk or dairy products. But the problem is some of that conventional dairy can be very inflammatory. So what I usually say, if you are living on a farm or working on a farm or just going to the farmers markets, you can get the dairy that way from, and again, I don't say directly because I know sometimes there's, how do I put it? They say it for farm animals, but if it's your farm, you get to choose that. But this is where I go. I go to the dancing goat farm. So yes, they are unpasteurized, but just be mindful, because by law, they're not allowed to sell to humans, unpasteurized milk, because it could be contaminated. However, the difference that the woman told me is they actually look at every single, for me, I'm getting the goat's milk, every single goat to make sure she's not sick. Now, if you're at a conventional dairy farm, there's, thousands upon thousands of cows. They can't check every single one. So that's why they pasteurize, because some of the animals may not be as healthy. So if they're milking and have infected, whatever those things are called, but if when they're pumping the milk and it's infected, their breast tissue, they may still pump it, but that's why they have to pasteurize it, to get rid of all the organisms.
Right.
Or bacteria that might be in that milk. But anyway, on a side note, the best places that I've found are the dark green vegetables, so kale, spinach, collard greens. They do have high sources of calcium. And if you look at study in wakame, if you get the dark green sea vegetables, so Japan or a lot of the Asian countries that eat traditional foods from their country, if you look, it's not high in dairy, and they actually have one of the lowest risks of osteoporosis. The countries that Scandinavia or the United States, which we do have a higher consumption of dairy, we actually have one of the highest risks of osteoporosis. So if dairy was actually the answer, it should be the opposite. So that's why I just say, if you're going to source your dairy, at least make sure it's coming from a healthy form, and just as best as you can, organic. And I understand cost, but doing your best with that. It's just, if you primarily get your calcium from dairy, you could just conventional dairy, just have to be mindful of the hormones or other things that might be in there, just to be careful. Yeah. They'll say something like no RBST, which is like meaning there's no added extra hormones in there. So I would at least look for the organic, and no RSVT, stands for a long hormone name. So they're not adding that to the animal feed or how they're treating those animals.
Yep.
Okay, I just want to make sure. Okay, and then so for the osteoporosis, again, we just mentioned the weight training, good calcium sources. Like I mentioned, some people are taking supplements. Honestly, I'm not a big fan of supplements unless you do have the diagnosis of osteoporosis. You can get too much calcium by supplements, and if you get too much calcium, it can cause calcification in the arteries or in the breast tissue. So you want to be really mindful. If you're going to take some calcium or vitamin D, which helps the absorption of calcium, I would take it with vitamin K2, which targets the bones. So it's kind of that, when you're, say the lights are out and you're driving and there's a police officer directing traffic, that's how I think of K2. It directs traffic to the bones instead of going to the breast tissue or the arteries, because you don't want to have increased risk of cancers or, heart disease or anything like that. So that calcium can go directly where it needs to go, into the bones. So vitamin D.
Should you take it with like vitamin K2, like a supplement, or? Yes,
if you're going to. So what I usually recommend, have my patients check their vitamin D levels. And I do want them to be optimal, because the range is 30 to 100. So if you have 31, by definition, you're within normal value. But for my patients, I want them upper normal. So I usually recommend to be above 60. I always say, think of a test score. If you're in the 70s, 80s, much better. You don't want to be in the 30s, 40s. I recommend for my patient. I'm like, that's low.
Yeah.
When they're upper, if they need some vitamin D, because remember, vitamin D gets absorbed through the skin, but some people are wearing sunblock, which is fine, especially if you're at high risk for skin cancer. It also gets absorbed through the gut, but if you're taking acid blockers like Prilosec or Tums or anything like that, you may not be absorbing your calcium or vitamin D well. So if you're not absorbing it, it's not going to get into your body. So some people do need to pay attention. I usually try, if possible, to get them off the acid blockers, because we need stomach acid to digest food and defend our immune system, as the acid is actually good for us in proper amounts. If there is a problem with acid, either too low or too high, we figure out the cause, treat the root cause. Obviously, if they need those medicines, they're called PPIs, Prilosec or Tums, we try to do it more short term, and then again, treating that underlying cause by doing a gut study. So we see if their gut is inflamed,
right,
inflammation and all that, so they can get better long term. Let's see. But yeah, the vitamin D3 with K2 if the patients need it. When you look at the studies, even in Florida with, the Sunshine State, there's a lot of people with vitamin D deficiency. So.
Okay.
Yeah. So did you have any other questions? Was this helpful?
Yeah, it is.
Okay. And I know it's not like, there's another step, but I wish I could just say, just do this or my magic wand. But if you get the hormones tested, then we can definitely go further and just dive deep, or I can give you the information what to do next. It's just, I want to make sure we're treating you and that's why, when I see patients too, it's all personalized. It's not like where everybody gets this, everybody gets that. We really want to figure out what's happening in your body. And sometimes it's a mixture. It's not like, people have just one thing going on. So if your thyroid's off a little bit, or if this is off, we treat, everything together. And it's like a symphony. When everything starts playing well, then you start feeling really, really good.
Right.
And those hormones, I know, for those folks who don't have insurance, they can actually, Quest and LabCorp and some other lab associations are letting people order their own labs. Just, you can price shop to see what the best price you can get. And then the next part is, once you get the results, especially if you do saliva, then you don't have any needle sticks or anything like that.
Right.
Genova does ZRT labs. Genova, they all do saliva testing if you're interested.
Okay.
Yeah. But that's all she wrote. This is what I have. But the bottom line at the end of the day is, and especially for Mary, there is hope. You're not a diagnosis. You for sure can get better. You can feel better. And it is a process. I know with health, this didn't happen overnight. It's not like it's just 1 second you get better, but I've seen people with the estrogen. I also brought this too. This is a cream. This is what I also take, but you can take progesterone creams. They have progesterone pills if you're not sleeping, but fairly quickly. I shouldn't say like in one day. It's not, remember, hormones are modulating the body versus prescriptions are just like turning things on and off. So sometimes some supplements or some things can take just a little bit of time, but I've had some folks fairly quickly, like in a few weeks, just start to feel normal, and after a few months really feel themselves. So I never promise anything, but it can be life-changing. That's what my patients have told me. So I say this because if you're able to get the hormones, you can literally get the results in a week or so. We can go over them. If it's specialty testing, that may take a little bit longer, but we can get those results and then just go from there, and we'll talk about it. Sorry. Yeah.
Okay.
Yeah. So and then the bone density, I had a bone density too. I mean, if you come visit me, I'll do one from our office.
Okay.
The sheet was down for a little bit, as long as we can get it up and working. But yeah, we have one that checks impedance. So it just checks how it's from the ankle. The official way to do it is from the spine and the hip. But if you're able to just go ahead and get that done, that would be great to see where you are right now. But know that, again, the bones are ever changing, where they can build, and there's a lot of things you can do to strengthen your bones again. So wherever you're at, you can get better too.
Yeah. Okay.
Yeah, but it's important, because the nice part is, if there is something going on with the bones, it could indicate other areas that might be affected. So if there's inflammation in the body, we just don't want it to go to the brain too.
Yeah. So how many like milligrams are you supposed to get? Is there a certain amount of milligrams that you're supposed to get of calcium per day at our age?
Yeah, and you can check the foods you're eating, and we can talk about the sources of calcium that you're getting right now. I'm sure there's apps you can do plugins. They say about, if you're osteoporotic, it's usually about 1,500 milligrams a day, and a little cheat sheet or a little way to calculate that number is, if you ever look at calcium, the serving size of whatever you're eating, it'll usually give a percentage. So if it says 30%, just add a 0 to that, and it's 300 milligrams.
Right.
So then you can see how much you're actually getting from foods you're eating, or if you are taking some calcium. Again, I would try to get it mainly from foods, and usually, spinach and all that stuff, you have to kind of pack it in, but then you're getting your vegetables. And I usually say rotate the foods you're going to eat. So you just don't want to eat only spinach. I would rotate those greens. If you like wheatgrass, or at least acquire a taste for it, and mix it sometimes when I'm first starting out with a little bit of juice, or they come in capsules. But those are some ways you can start getting some of those dark greens if you're not eating as many vegetables. Yeah.
Okay.
Yeah.
Okay.
Yeah. But we can again talk further about it, but it's really good questions. And remember, if you're doing any dark greens, if your iron is low, it's actually good to add some berries to that, because the vitamin C will help the absorption of the iron.
Yeah. Okay.
Yeah. And sleep hygiene is good to just make sure to power down. Guidelines say a few hours before, but I understand life happens. So, if you can't do it 2 or 3 hours before, so you're getting ready, at least 30 minutes before bedtime. I have it on automated, so my phone just starts to turn off at 10 p.m. So does my computer. And that way I don't make it hard to be healthy. Make it easier.
Right.
So if you kind of automate certain things, and then dimming the lights, make sure the music is lower, the TV, same thing. I wouldn't watch anything too activating right before bedtime.
Right.
Mm-hmm.
Okay.
Yeah. Well, I'm going to stop the recording now. If there's anything else, I just want to say thank you. We can stay on the call for a little bit longer.
Yep.
Thank you so much for listening to the Fun Health Podcast with your host, Dr. Tanya Gold, your happiness doctor. Stay tuned for more uplifting and inspiring episodes to live your best life. Make it fun so it'll get done. You're so much more than a diagnosis. Remember, you're not alone, and your life and your health matters.